These images were created by artists who have used their talents to communicate how they perceive their headaches. This artist depicts the feeling of compression and confinement during a 5-day bout with a migraine headache. Here, another artist eloquently communicates the incapacitating pain that surrounds her eye and the intense throbbing accompanied by the cloud of heaviness and feelings of despair that is part of her headache. This is how this artist experiences the multifaceted impact of her headache. While still another artist's work creates an image of her headache in this time-lapse painting. She focuses on the pain surrounding her eye and the confusion she feels. Here we see a portrait of how the pain of a headache creates, for the artist, a great wave of depression and destroys any sense of well-being. And this dramatic evocation of the pain experienced during a headache shows the artist's conception of the pain in his eye, the numb and heavy hands, the throbbing pain in his temples, pain that is made worse by the slightest movement.
Those of us who treat headache know all too well how serious this problem can be. We understand the suffering and the pain that our patients go through as they live a life impacted by headaches.
These are the facts of the matter. The impact of headaches on the lives of countless numbers of people simply cannot be overstated. Headaches cripple more people than motorcycle accidents, car collisions, and industrial accidents combined. Last year alone, headaches caused a loss to industry of over $50 billion, measured in time away from the job, loss of productivity, and in medical and insurance costs. In addition, over $400 million are spent annually on over-the-counter pain medication. Headaches are a serious health problem that command our urgent attention.
The first step is to decide when the headaches warrant medical attention. When should you see a physician about headaches?
Here are some of the signs that indicate that it's time to consult a physician. The headache strikes suddenly and cause severe pain.
They come out of the blue. I cannot pinpoint it to any food or drink or stress or anything like that. I could wake up in the morning, as soon as I get out of bed, zap, I'll get a headache.
They affect one side of the head, and there is eye or ear pain.
When I lift my head and go like this, we can just feel everything creak and crack, and I can feel it come up from my back and the back of my neck, and it always just comes up like the left side, and it just stays right here.
There is nausea, vomiting, hallucinations, and sensitivity to light or sound, or both.
But also I get very nauseous, hot, sweaty, and then I'll be very cold. The light hurts.
The headache recurs in a definite pattern, the same circumstances, the same time of day, and lasts for about the same amount of time. The location of the pain is the same.
Almost on a daily basis, maybe at least 5 out of 7 days a week, I'll get a headache. And it's always on the right side of my head.
The pattern of the headaches changes in terms of how often they occur, how severe they are, how long they last, and where the pain is.
The pain's different with each headache. Each headache has its own personality, really, is what I find. I can never predict what's going to happen or when it's going to happen.
The headaches make it difficult to sleep, awakening the sufferer during the night.
I got to the point where I didn't want to go to sleep at night because I knew the headaches would come on, and as long as I stayed awake, I wouldn't get those headaches, but you can only do that for so long. But regardless of how tired I was, they would always come within 1 hour from the time I fell asleep.
The headaches cause confusion or even a loss of consciousness.
I don't have clarity of thought. I'll be talking, speaking a sentence, and I'll lose my train of thought in the middle of the sentence. I'm just not myself.
The headaches are persistent.
Then sometimes I'll have 2 headaches in one day, like in the morning, one in the evening. Sometimes it'll last for 1 week, sometimes it'll last for 5 months.
The headaches interfere with a normal social life.
But I have missed out on some events. I have missed out on some weddings. We just had a wedding the other day, and I was at the wedding, and it was a live band, and the drums, I just felt like where the cymbals were going off in my head. And I found myself spending more time in the breezeway of the corridor of the wedding than I was actually at the reception.
The headaches make it difficult to work and affect on-the-job performance.
Makes it difficult to work, especially when you're in a meeting and you're having one of these headaches. I think it might make me a little more irritable, less patient at home, where you're quicker to respond to someone. And it's just, it affects the quality of life.
The physician to see for a headache first is one's primary care doctor, their family physician, or their general internist. 80% or more of headache patients can be well treated by a primary care physician. If the primary care physician has difficulty managing a patient's headaches, then it's appropriate to refer a patient to a neurologist or a headache specialist. When we think about headaches, it's important to distinguish those headaches that are caused by medical problems such as fever, infection, tumors, or inflammation of arteries. The headaches that we would call secondary headaches, it's important to distinguish those from what we refer to as benign or primary headaches. The primary headaches are composed of cluster headache, migraine headache, and tension type headache. Cluster headache is called cluster headache because the headaches occur in clusters or bunches, meaning that patients will get from 1 to 4 attacks a day, every day, for anywhere from 4 weeks to 4 months.
Instead of a throbbing pain, like they say with migraines and nausea and light bothering the patient, I don't have that problem. I don't have the nausea. The lights don't bother me. And it's always on this side of the head, and as opposed to a throbbing pain, it's a more severe jabbing type pain. Like I said, almost like someone had a knife and just sticking it in my head here.
In addition to this excruciating one-sided headache, the eye on the affected side will typically droop shut. It may get red. There's often tearing of the one eye on the painful side. Oftentimes on that same side, the nostril will become congested, and oftentimes the nose will run just on the one side where the pain occurs. Cluster headaches typically last about 20 minutes to 2 hours, so they're relatively short in duration. They typically occur at night, awakening people from sleep.
The bad thing is I can't sleep when I have a headache. I could just lay there, but I can't fall asleep. And it'll last anywhere from 3/4 of an hour or an hour, maybe up to half a day, maybe almost a whole day. And it'll come and go. It'll ease up, it'll come back. It'll ease up and it'll come back.
Cluster headache is oftentimes called suicide headache because the pain is so excruciating and occurs night after night after night without relief unless the patient gets under medical therapy.
Cluster headache occurs in 1 in every 1,000 men and 1 in every 10,000 women, so it is relatively rare. The first step in treatment is to recognize and avoid the precipitating agents that can provoke attacks of cluster headache during a series when the sufferer is susceptible. These agents include alcohol, even in small amounts, and nitroglycerin.
These are very, very excruciating and severe headaches, so virtually all patients who have cluster headaches are treated with both preventive treatments as well as medications to use when they get an acute attack.
The medications of choice in the treatment of episodic cluster headache are calcium channel blockers or methosergide. Often the corticosteroids are used together with either of these 2 drugs. For patients with chronic cluster headache, Other agents, such as lithium or calcium channel blockers, may be used. Histamine desensitization or surgical intervention may be considered for chronic cluster headache sufferers who have not responded to other forms of standard treatment. Because of the brief duration of an acute attack of cluster headache, abortive treatment is difficult. Oxygen inhalation by face mask can be used at the first signs of an attack and is often effective, with relief coming within a few minutes. The patient may also respond to ergotamine preparations if used immediately after the onset of symptoms. Some patients have also responded well to nose drops containing an anesthetic agent such as lidocaine.
Migraine headache is a common disorder. Migraines occur in about 1 in 5 women and about 1 in 10 men in the United States. Migraines are a disease of young people. They tend to increase around puberty, and they're most common between the ages of 20 and 50. This is a hereditary disorder in which about 3/4 of patients will have somebody else in their family who also suffers with severe headaches.
The pain, it's immense. It starts on the left side near the left temple, and it pounds. It's pounding like every second, like someone has a huge hammer inside my head, full force, hitting the side of my head.
When we talk about migraine, we're talking about a headache that is intermittent, meaning it doesn't occur on a daily basis. It's a headache that's typically a one-sided headache that's pounding or throbbing. It's a headache that's associated with stomach upset that can be as mild as not feeling like eating to as severe as nausea and vomiting.
It's like being in a chamber where there are a million echoes, and you are hearing sound as loud as you can imagine from everywhere in your body. And not only sound, it's light. The light really affects my body.
It's a headache that's associated with sensitivity to light, sensitivity to noise, and sometimes sensitivity to odors. It's a headache that gets worse with physical exertion, such that patients want to lay down in a dark, quiet room, pull the covers over their head, and go to bed.
And I think the hardest aspect of it is that the throbbing is in accord with your heartbeat. So it's like, well, you're glad your heart is beating and you're alive, but every time your heart beats, you feel that slamming pain in the top of your left side of your brain. So you want to be alive and you want to be dead at the same time. You just hope you can survive it.
Migraine is what we refer to as a vascular headache, meaning that it involves the blood vessels surrounding and involving the brain. What happens in a migraine attack is that initially the blood vessels in and around the brain constrict or squeeze down, and then they dilate or swell and become inflamed. When the blood vessels are swollen and inflamed, every time the heart beats, it pounds against the blood vessel walls, causing that pounding or throbbing sensation in the head. These inflamed arteries release certain chemicals which cause the nausea and stomach upset that's so common in migraine headache.
Common factors that may trigger migraine headache include an irregular sleep-wake cycle, hormonal fluctuations, missing or delaying a meal, and bright or flickering lights. In addition, there are certain foods that can trigger migraine headache and should be avoided. Included are red wine, chocolate, aged cheeses, and food containing MSG, monosodium glutamate, and nitrites or nitrates.
When we talk about the treatment of migraines, we really talk about two approaches that are used together. When migraines are frequent and debilitating and interfering with the quality of life, we will oftentimes use preventative therapy, taking something or doing something every day to reduce the frequency of migraine attacks. With preventive treatment, we can reduce the frequency of migraine usually by half or more, so that people will get only half as many attacks as they did before preventive therapy.
For the prevention of migraine headache, the recommended medications include beta blockers, calcium channel blockers, antidepressants, non-steroidal anti-inflammatory drugs, and anticonvulsant medications. These medications are usually taken daily and have proven helpful in reducing the number of migraine attacks and their severity. Non-drug therapy can include diet control, biofeedback, and stress reduction. For mild to moderate migraines, over-the-counter analgesics can be used. For patients experiencing moderate to severe attacks, initial therapy often begins with isometheptine or non-steroidal anti-inflammatory drugs. In patients who do not respond to these, sumatriptan or ergotamine are usually the next drugs of choice.
Type headache. Tension type headaches come in two forms. There is the intermittent or episodic tension type headache. Episodic tension type headaches occur in greater than 90% of Americans. This is the headache that's described as a band-like pressure that oftentimes occurs after people skip meals or if they don't get enough sleep at night, if they have excessive tension or stress at home or at work, or with bad posture.
When I get up, I'm doing pretty good. As my day goes along, the headaches seem to come on, and come on. 10, probably a 7 or an 8, that's really starting to scream at me a little bit.
Much less common, but much more debilitating, is the chronic tension type headache. And this is the headache that occurs almost every day, that again is described like a pressure within the head or a band or vice across the temples. This is a headache that's oftentimes mistaken for sinus headache because there's so much pressure back behind. Unlike migraine, isn't associated with being sick to the stomach or terribly sensitive to light or to noise.
The headaches sometimes feel like I'm carrying around an extra 20 pounds on my shoulders. I just feel like there's weights here and weights here, and I just feel like that pain just is like a trigger point in my neck. It just comes up the back of my neck, and I could just feel it, and it usually stops right on each side of the temples, right where I'm pointing to now. I had this described to me and diagnosed to me as a tension muscular type headache. The pain is not an acute pain. It's not like a pain like, oh boy, I just got a shot, like a real electrical shock. It's more or less like an
Episodic tension type headache is oftentimes treated by rest, by simple analgesics or over-the-counter medications.
There are several over-the-counter medications that can be used effectively in the treatment of episodic tension type headache. These include aspirin, acetaminophen, ibuprofen, naproxen sodium, ketoprofen, and certain combination products.
On the other hand, patients who have chronic tension type headaches, these daily unrelenting headaches that can go on for months to years, have a much more difficult problem. This is a type of headache that requires medical assistance.
For chronic tension type headache, the drug and non-steroidal anti-inflammatory drugs. In addition, the use of beta blockers can be helpful when there is a mild chronic state of anxiety.
So I guess there's a combination that we got to find out the middle of the road, where I can work and where, through medication, exercise therapy, etc., that the problem could be combated and I can live a productive life where I can be pain-free.
Of the non-drug therapies for chronic tension type headaches, biofeedback and relaxation therapy can be exceptionally useful, but also very, very helpful for the treatment of chronic tension type headache is exercise. Exercise works to help improve posture, to improve blood flow to the muscles, and to elevate the levels of painkillers within the brain.
Exercise is important for people with tension type headaches because they need to maintain the flexibility of the neck, the cervical spine. In tension type headaches, you find that people have been in faulty postural positions for most of their lives.
Lower back,
And the muscles have changed their flexibility relationship. The muscles are no longer in balance. So the muscles that are in the back of the neck, that go from the neck to the shoulder blade, are overstretched. Those are the ones that are overburdened in having to hold the head up when the head is held in a forward head position. In addition, the muscles in the front of the neck are shortened, and those keep us in the forward head position. The stretching and flexibility that we do help these muscles to get back into their normal length relationship. Here are some of the exercises that I find helpful for tension type headaches. The first exercise that I use is chin tuck. Can you do a chin tuck? That's where you keep your chin level and glide your head back as much as possible, comfortably possible. That's it. Do that again, please. Relax. Keep your chin level. And then go back and relax. It helps some people to take a focus point in front of them and then go back to keep the head level and relax. If that's painful, if that's sore, don't go back that far. You want to do this in the pain-free motion. Do that again, please. Keep your chin level. Go back. And then relax. Do you feel the pull? Mm-hmm. Okay. I use turning or rotation, where a person turns their head from one side to the other side. I want you to turn your head as much as you can from side to side. That's it. Stay within the pain-free range. Don't make it hurt. And then to the other side. And then come back to center. Is there a difference from side to side?
It pulls on both sides.
On both sides. Okay. One side more than the other?
This side.
Most people have a difference from side to side. What I'd like to do is show you a stretch for that. Can you do a little bit of a chin tuck? Turn to the left. You're going to use your left hand on your chin for a few ounces of pressure, just fingertip pressure, and then your other hand on the other side of your head, and just within the pain-free range. Don't make it hurt. And then change, go to the other side. Do a chin tuck and turn. And then your hand on your chin, your other hand on your head. And each time you do this, you should find that it's looser and should go a little bit farther. Okay, and come out of it. And you should do about 5 or 6 of those, and then check your range and see if you're looser. What's happening, Jody, is you carry your head a little bit forwards. That puts your muscles at a disadvantage because they're on strain, trying to hold your head up. And by bringing your head back into alignment, they're in a better position to function. They won't get as much overstressed and overstrained when you're in a better position. Okay. I use side bending. Side bending is where the head is bent from one side to the other, the ear coming down to the shoulder. This also is used to the full limit of the pain-free motion. Again, hand position can be used to. I'm going to have you do it now with a little bit of a stretch pressure. Do a chin tuck, and then bring your ear down to one side. You're going to place your hand on the top of your head near your ear, and fingertip pressure. Pull down and relax.
That's a good stretch.
Want to do that to the other side?
Yeah.
Good. A 5 count would be best. A long 5 count would be best to hold it. Do again, please. Chin tuck. Bend down to the side. Fingertip pressure. Looks good. And then again, chin tuck, bend down to the side, fingertip pressure. Good. And relax. The next one we're going to do is bending forwards and bending back. I'm going to have you do this with chin tuck now. Chin tuck a little bit, bend down. You feel a pull, just hold it there. And then come back to center, chin tuck, bend up a little bit, and then relax. Okay. Would you like to do that again? Chin tuck down, and relax. Chin tuck up, and relax. And relax. Let's do an exercise for the muscles at the base of the skull. These are the suboccipital muscles. They're the muscles at the top of the neck.
and they're right back here. Do those feel tight to you?
Yes, very.
Okay. This is going to exercise them, and we're going to do that in two positions. One is to make a yes, and the other is to make a no.
I also use chin tuck with a yes maneuver, where the person makes a little bit of a yes movement, and then chin tuck with a no movement, where the person makes a little bit of a no movement. That particularly stretches and moves the muscles underneath the neck.
You can do this any time of the day. At work?
Posture is important because the position that we hold ourselves in, whether it's during activities or if it's in a stationary position, in order for the muscles to be in good alignment, so the muscles themselves as well as the joints aren't in positions of strain or stress or overload.
Jody, it's important for flexibility exercises to help you to manage your tension headache, but just as important, you need to also correct your posture. What I'm going to ask you to do is to correct down here and up here. You can feel how you're in a sway back position, your shoulders are forward, you have an increased curve in your thoracic spine, and you're in a head forwards position. What we're going to do to correct this is ask you to tighten up your tummy muscles and your buttock muscles. Okay? And then you're straighter here, and that allows you to get into a chin tuck here. Okay? Can you relax? And go back to your slump. Let's do that again. Tighten up your tummy muscles just a little bit, and your buttock muscles. A little bit of tightening. And can you feel how that opens you up here,
Yes.
lifts you here, straightens you here, and allows you to stay in a better position here? You can't keep this upright and straight if you're slumping here. So you have to make sure that at your hips and at your low back you're in a aligned position, and that allows you to stay aligned here and here.
To get a flexibility in the front of the neck and shoulder area, there's the chest stretch. This is done in a doorway or in a corner where a person can get more flexibility at the neck and at the shoulder. A stretch is felt in the front of the shoulder. This is very helpful in getting a good posture position instead of being rounded forwards.
This exercise, Jody, is going to give you some flexibility in the front of your neck, shoulders, and chest region. It's going to open up this area. What you're going to do is you're going to stand in the corner with your hands on the wall, and you're going to step forwards. Stand in the corner, okay, with your hands on the wall, and then you're going to step forwards till you feel the stretch in the front of your shoulders. Hold it. And then you can, did you feel that on one side more than the other?
Yes, I did.
That's okay. That's normal. Do it again, please. That's it. And you can do this throughout the day in the home or your office to give you that stretch. This lets your shoulder blades come back and helps you to stay in good postural alignment. Okay. Let's try with the other foot forwards. It doesn't matter unless it matters to where you're feeling the stretch.
No.
No. Okay, let's do it again, Jody. This time, place your hands a little bit lower. Try that again. And you feel the stretch a little differently.
Yes.
You can modify that depending on how it feels for you.
The main advice that I can give for people exercising on their own at home is to be consistent. Whether it's a daily program, whether it's a regular program 3 times a week, chronic headache sufferers have told me that the most important thing that they can do for themselves is really twofold. One is to make sure that they're in a good posture. They monitor their posture regularly. They make sure that they're positioned regularly. And they all admit that at times they forget, but then they are monitoring themselves. The second thing that they say is that to maintain their flexibility is the best thing that they can do for themselves.
Today, headaches remain a serious and urgent health problem, afflicting countless men, women, and children. In recent years, our knowledge about this all too common illness has increased incrementally. New diagnostic technologies, new therapies, and new advances in pharmacology that have resulted in more effective medications have significantly influenced the way we treat headaches and have greatly improved outcome.
The most important thing to remember is you don't have to continue to suffer with headaches. Today we have the tools to accurately diagnose and the therapies to effectively treat headaches.